today. This is awesome.
Yes, yes. We're trying to figure out all the kinks, but I'm excited to be here and to be able to share this also on all my platforms as well with all of you so that everyone can see the amazing work that you are doing in supporting couples that are having challenges with fertility and creating this platform. I'm honored to be a part of this with you. I'm honored. Thank you.
Great. Thank you. So I'll tell you what. So a little bit about the fertility family and what this is all about. I decided about a year ago, well, more than that, a few couple years ago, that I'm going to be a mommy no matter what. And I'm 42 and I'm single. And inside of that,
Everyone,
it's like,
gentlemen, are you listening? Go ahead, you.
and it was kind of like one of those things you got to decide or choose. What is it that you're going to do? Right. And so, through after a lot of consideration, working with my sister, we were going to do it together. My sister transitioned, and then I was like, "Whoa, really doing solo mommy? This would be major." But it's really important to me in terms of family and legacy. This is what I'm committed to. And so inside of that, I created the fertility family. Did a lot of prayer and meditation work, and Spirit was like, "There's other women out here in the same situation, and they want support as well." And I was like, "Okay." And Spirit said, "So you can just make your journey live." Who I am is someone who is in the world of natural health and wellness, but my specialty is not fertility. So I know what I know, and I know what I don't know. And when I don't know something, I go get help. And I started, of course, with the divine. And the moment I did that, I ran into the one and only Dr. Julissa, who had her new book. And I was like, "Oh my goodness, this is a sign. This is definitely what is for me to be doing." And that's how the fertility family started. And this is designed to really provide natural and affordable solutions for people who may be dealing with fertility challenges. And a challenge can be everything from like, I'm not married and I'm not in a relationship and I want to have a baby. That's a challenge. But it can also be,
And it's common
being
today.
or being told that you're infertile for whatever the reason. It could be you've tried conventional pathways to fertility and your bank account may be exhausted, you may be emotionally exhausted. Those are challenges. You could just be a mature mommy like me who I have no reason to think there'd be a problem, but you're like, "I'm just nervous." And you would like some support and insight. And then there's people who don't even have challenges per se. They just want to have a baby and be healthy, and they're planners. So people who are preconception planning, right? And just say, "I want to do things right to maximize the wellness of my little one to be." And with all of that happening, where do you go if you want support and questions, particularly from a natural perspective? Because most of what we hear about fertility isn't holistic. And so, yeah, so that's how this kind of started. I started rattling my resources. So, who do I have in my circle? And the fertility family is just that. It's my well-being team. And then there's other women and couples who are on this journey, and we're supporting each other and making this happen.
Mm.
So I see some people say hi, hi.
Yes.
And so that's the fertility family. And it's pretty cool. The book we're using, of course, is your book, The Naturopathic Approach to Fertility. Really comprehensive. I tell people you can read this book and get 99% of your questions answered. And then it's outside of the text, which is like everyone who's in the family, we're like, get the book because it has the answers. And then once a month, you're able to go live with Dr. Julissa. And then weekly, we're live with other experts, everything from doulas to womb health practitioners, got midwives, massage therapists, financial planners, all sorts of people who can really help you take care of everything that you need to have a happy, healthy pregnancy and conception and birth. I'm even sharing some great resources around feminine health because a lot of women just are like, I didn't even know there are things I'm supposed to be doing to keep my honey pot healthy and happy. So we look at everything. Today we're going to be talking about men's health. I'm super excited to get to these sections in the book. And so, of course, this week is you. So for people who may not know Dr. Julissa, she's awesome. When I met her, just in general, she already was getting, like, her accolades were being sung at our convention. And then when I was hanging out with some of my people, and they're like, they brought this book by. I'm like, oh, she's right outside. She's signing her book. I'm like, let me go get this book. And then I met her, and she's just so warm and loving. It was awesome. I was like, this is the bomb. And when I reached out to her about the Fertility Family, only having met her at this conference, she was like, of course, oh my gosh, I love this. She has the servant heart and the spirit of service. I mean, the reason the book was written is because that's who she is. And so, like I said, so she, you've been in the wellness industry for over 20 years. She's a naturopathic doctor, so an MD. A certified natural health professional, practicing over 22 years. She's based in Manhattan, but has clients all over the world. So you are just such a blessing and a resource, and I feel just a treasure to the community. So I thank you for being here. And so for my folks who are watching live, I'm going to bring on Dr. Julissa to just say hello and share whatever is on her heart right now. All right, you're live.
Okay. Thank you so much for having me, Kania. And I believe that all things and all people that come into our realm, all things happen for a reason. I love that I met you last year once and only once, and at that convention, and so to be part of this journey with you, for you to create your little miracle, I'm floored that I'm able to be a part of your journey, and just I'm honored. I can't wait for you to have baby fabulous, as you call the baby. So let's get this done. Let's do this, because I'm flying out there to your baby shower. Okay, so let's make this happen. And I feel that most definitely it's more often than not that a lot of women are finding themselves at a certain age, not in a relationship, and finding themselves with that desire, wanting to have a baby just like you, single and ready to move forward and take on that role of mother, and are going to do it alone. They're going to find a sperm donor and so on, just like you are. And so let's make sure that for even those women out there that are going through that sort of a journey, they have support. And of course, I know your platform is also for couples. You have couples that are part of your Fertility Family live group, and I love that they're able to send in questions to you. And now that we're doing this a bit different tonight, I'm honored to have you also here on my Facebook pages, on all three of them, and that they can also interact with you and I, and everyone can write down your questions as well while we're here live in the comments. We're able to see them, and that's what we want to do. We want to address your questions and your concerns, and as we move forward with the other chapters that we'll be addressing in the book. And I'm honored to support you in this. I immediately said yes to you when you called me and said you were putting this group together to support others, and I said, yes, let's do it. So your vision, I'm honored to be part of your vision.
All righty. So let's talk about the book in our section, so that we're covering today. Okay. So you guys, the text is, I mean, it's so comprehensive. We're in our third cycle of, we say, classes in session. And so far we've covered, why take a naturopathic approach to fertility, what causes infertility, medications that hinder fertility, how your thoughts and emotions impact fertility, hormonal imbalances can interfere and even prevent conception. So that's what we've covered so far. And so if you missed any of those, you want to visit live.fertilityfam or fertilityfam.com, because that information is available for now. And then today we're covering how circulation problems impact fertility, how sexually transmitted diseases affect fertility, and sperm counts. And then I'm in the group, and I've got some questions and some things that people have expressed questions about. And so I'll bring some of that in as well, and just ask some questions. All righty. So as I'm reading in the text, and it's funny because I was just having a conversation about circulation issues. And we were talking at that time around mature men in relationships with men who are reaching a certain age, as we'll say. And how what we've noticed is that sometimes there's some issues with performance.
Yes.
And then what you mentioned here in the text is that can definitely be related to circulation issues. But even more than circulation issues, even more than performance issues, I should say, these same circulation issues can be indications of some serious disease. So I wanted to just take a moment and look at that, because a lot of men I know of many ages are using drugs and things like, we'll call performance enhancing drugs, as opposed to dealing with some of the underlying causes of it. So what are some of the dangers of choosing to use an erectile drug versus healing whatever is causing the issue? If you can, you know what I mean?
Yes, absolutely. And that is a wonderful question, which actually has come up as well with some of the couples that I've helped with fertility. So the challenge here is this: for those of you that do have my new book, The Naturopathic Approach to Fertility, if you've been reading it, you'll know that I'll mention that the main two organs, at least within Chinese medicine, that we focus on when it comes to fertility are the kidneys and the liver. The liver has various functions. It's the liver of fat, and it's the filter of blood, but it is also the filter of hormones. And so a man that, for example, is taking medication or some sort of drugs or some sort of sexual enhancers to be able to perform sexually, to enhance erection, just so that he can perform. And if it is a drug, if it is chemical, then know that that is going to overload the chemical plant of the body, which is the liver. I must have a liver that is very healthy, working properly, not overloaded, not burdened by high levels of toxicity, so I can help that man with balancing his hormone levels and so on. So it's crucial, and a lot of people don't consider this, it is crucial that the liver be very healthy. And the problem is that being the chemical plant of the body, these sorts of drugs have to be filtered through that vital organ. And so do everything in your power not to do so. Another challenge is that you will want to do everything in your power to prevent yourself from taking in drugs and chemicals, because you don't want all that to be within your sperm, and that then be part of what is being transmitted into, when you go and conceive, that is going to then be absorbed by that egg when you are conceiving. So you want to have as healthy a body as possible, as free from toxicity as possible. And that's the challenge there. Erection problems, erectile dysfunction. Obviously, to have a baby, you must have sex. And if the man can't perform, then it's pretty difficult to have a baby and get pregnant. And so, of course, that's the challenge there, right? But what is erection? It is absolutely blood flow going to the genital region. And blood flow must be good for a man to have a good erection. And so that's where I had to and felt I needed to dedicate a chapter to that, how circulation problems impact fertility, specifically a whole chapter dedicated to that starting on page 80. So I hope that answered your listener's question there.
Yeah, awesome. Thank you so much. So when we talk about circulation, and then outside of performance issues, one of the things that you point out to the book is anemia. And I know so many women are anemic, and they may be undergoing iron therapy, and they're taking ferrous, like iron pills, which again causes its own. I've been there before, so I have the sickle cell trait, and for many moons, I was taking iron supplements, and of course that would create some digestive issues, so that I'm taking stool softeners and things, right? And I was committed to getting out of that cycle. One of the reasons I got into naturopathic medicine. So for people, and so outside of just taking herbs, because I know sometimes people have like, oh, I'm going to take herbs instead of medicine, and they feel like it's like a switch. And I wanted to talk about lifestyle. And we have this awesome program where we have people take on a lifestyle change inside of eating. So could you speak to why it's important not to maybe switch, or do you think it's important not to try to switch herbs for medicine, but instead to use herbs in conjunction with a lifestyle modification?
I absolutely agree that herbal medicine should be used with a lifestyle modification. Addressing the challenge of anemia, I would love to share a research study and then address how crucial it is, and that being part of that circulatory challenge, as to why that must be corrected. When you mentioned diet and so on, I'm going to address that also. I'm breaking down your question there. So for the ladies out there that have had challenges with conceiving or having some reproductive system issues, medical research has confirmed the link between severe anemia and fertility problems. Again, I'm referencing now page 81 of my new book, The Naturopathic Approach to Fertility. So, as an article in the Journal of the American Board of Family Medicine states, though rarely encountered in women of childbearing age, untreated pernicious anemia has been found to be a cause of infertility. Now, once treated, conception often occurs within months. And so, in that case, most definitely, I'm going to recommend some diet lifestyle changes, including bringing in herbal therapies, which I give you all of those herbal therapies to correct each and one of these challenges that I address within my book. You have the solutions there. I don't just talk about the topic and leave you in the air without knowing how to resolve it. Now, apart from that, and I don't want to give everything away because obviously it's chock full of information, and when they obtain the book, they'll be able to learn exactly what those herbal therapies are. I'm going to, yes, give this little tidbit, Kania, which I don't know if you know, that in our diets, and it's a lot of what people intake here in the United States, a lot of foods contain garlic. Okay. And garlic is a natural antibiotic that I feel was placed on this earth so that we can use that to help us when our body is definitely ill, and to help us as that natural antibiotic that we really should be using instead of running and rushing right away towards a chemical antibiotic. Now, having said that, the studies, and I've written an article on this as well, it's been shown that garlic should truly only be used when the body is in an ill state of health, that using garlic for more than 7 days can cause chronic anemia. And again, I've shocked you. You must read my article. You must read my article. So as a spiritual woman who practices Taoism and Buddhist practices as well for many years now, for example, we Taoists and Buddhists do not intake garlic and onions, and I'm also addressing those that are part of the Alliaceous family. So spring onions, red onions, chives, leeks, okay, and white onions. And these foods, garlic especially, when intaken more than 7 days, can cause chronic anemia. So when you're sick, please, when you're sick, when the body is in an ill state of health, it states, most definitely, please grab yourself a jar, pour honey, chop up a whole entire onion, chop up a whole entire garlic clove, put that jar together, mix it up, take 3 tablespoons a day for 7 days, and stop. Stop.
Okay, but Dr. Julissa, I love to cook with garlic and onions. Oh my gosh!
Oh my God! See, that's why we need to work together. So it is. So when I come across, absolutely, and that's why I had to address so many issues that many people don't take into consideration. What happens is that garlic interferes with the blood-brain barrier when intaken for more than 7 days straight. Now, would you take an antibiotic every single day for the rest of your life? And there are people that eat garlic every single day. Once again, it's not that it's bad. It is an absolute gem of gold because it is truly Earth's natural antibiotic, specifically that should be used only when the body is in an ill state of health. And so, when you're sick, 7 days, and you must stop. Now, so if you have this issue with, anemia or chronic anemia, thalassemia, and sickle cell, I recommend you eliminate that immediately from your diet, including onions, leeks, chives, spring onions, and what? Yes, we do not intake it. Can I tell you that as Taoists? Let me explain. We don't intake it. Let me explain what else it does. Okay, once again, it's not that it's bad. When you're sick, you must have it as a natural antibiotic, 7 days, and you stop. Now, Stanford University study, just to throw this out there, and I put all of this in my article. You can find it on my website at drjulissa.com. Stanford University study. Did you know that pilots cannot intake anything with garlic minimum 3 days prior to flight? As far as a study done by Stanford University, because it makes your reaction time 3 times slower. And so going back to, for example, the spiritual aspect of why we Taoists and Buddhists don't intake it is because it causes emotions of lust, it causes emotions of anger, irritability, and also does not allow us to go into profound meditation the way we can. Once again, remember that after 7 days, garlic tends to interfere with the blood-brain barrier. And so that's where the reaction time being slower, that causing those types of sensations, we don't intake it in this spiritual practices. And so if you're anemic, stop eating it.
All right. See, today that's a big one.
Yes, yes.
Okay. So past circulation.
For those that, for example, have symptoms of anemia, a lot of people don't know what those symptoms could be. Maybe they've never done blood work to find out, or maybe, see, this is the challenge as well. And you tell me if you come across this with your clients, right, Kania, that they may do, for example, blood work, and if they don't pass that certain number, then they don't have that challenge, then they don't have that issue. But a minimum weakness in a person may demonstrate itself in a certain manner while somebody else may have no symptoms. And so just so that you can start getting an idea that maybe if you have fertility challenges and maybe you suspect you may have anemia and you have, for example, sickle cell, but let me state, for example, very quickly some of those symptoms that you may want to look out for. So are you having, ladies and gentlemen, possibly issues with numbness, tingling of the extremities, hands, feet? Are you having overall weakness? Are you having some yellowing? You got it? Okay.
Yeah.
Are you having some yellowing of the skin, gastrointestinal disturbances that cause a sore tongue? And that's a phenomenon. Yes, a very strange symptom that a lot of people don't take into consideration when they're having issues with, for example, chronic anemia. Now, the condition of having that gastrointestinal disturbances with a sore tongue, this condition is often marked by a partial loss of coordination of the legs, where, for example, a person may say, oh, my leg gave way. My leg gave out on me. You've heard maybe someone say that. A partial loss of coordination of the fingers, not being able to grasp something the way they would want to, or a loss of coordination of the feet. Oh, my feet went under on me. You hear people sometimes saying that. Other symptoms, possibly of anemia, a loss of appetite along with diarrhea, and this may also be present. So in addition, even nerve deterioration is known to occur if a person has anemia, and all of this affects fertility.
Okay. And the best part about this, you all, is that inside of the book, in that glossary she talks about, she literally tells you what to take in the dosages, the days, like how often to take it. So you don't have to be stuck with it. You get the solution. So we're gonna switch to the sexually transmitted disease portion. And I will tell you, I was really surprised when one of the things you mentioned is that a lot of the time women do not experience symptoms of STDs, particularly the chlamydia and the gonorrhea. But of course, their bodies are experiencing the impact of it, which could, whether it's pelvic inflammatory disease or whatever. So, because I don't know, I've been blessed, right? I've never experienced a sexually transmitted infection or disease.
Amen.
And I can say, I know women who have had complications due to them, including like having to have C-sections because of scarring on the cervix, which wouldn't allow them to dilate fully, and so they had to have cesarean sections. So for people who may have had sexually transmitted diseases or infections, but maybe even have them treated, is there anything that they should be worried about that they can look to correct before conceiving? Because like, are there lingering effects maybe? I guess that's what I'm asking.
Absolutely. Another wonderful question. So this section where I address STDs begins on page 88. Once again, for those of you that are able to follow along and reference the book and type your questions here as well, and these that we're addressing. The challenge is that, again, as you said, many women may have no symptoms after they were treated for the STD when they first contracted it. And I give the solutions there to the possible underlying cause of having suffered an STD being the cause now of them having challenges of infertility. Chlamydia, for example, is an infection can cause infection of the fallopian tubes. And how many women don't say, oh, they put that blue dye in me and they wanted to see if my fallopian tubes were blocked and so on and so forth. And know that chlamydia can cause that infection without any warning signs. Pelvic inflammatory disease, which is a silent infection in the upper genital tract, also results in permanent damage to the fallopian tube. So consider that if you had that sort of a challenge in the past, then look into using, and I recommend here, herbal therapies to help balance and restore and nourish and help correct underlying inflammation. That I've had to work with patients that have those sorts of issues, severe pain every time during their period after having suffered a bout of being exposed to STD, and so on and so forth. So it is more common than you can imagine. And yes, there are ways for them to correct those solutions. I give the herbal therapies there. But the fact that it can definitely be a factor is a definite. Chlamydia, gonorrhea, I address all of that in this chapter. I mean, there's an estimated 2.86 million cases of chlamydia and 820,000 cases of gonorrhea occur annually in the United States. So
And it's just important for what I just wanted to point out, for because like I said, I've met women who they're like, oh, I got that handled years ago, not realizing there could be long-term repercussions. But regardless of all that, what's so wonderful I feel about our bodies is that almost anything that has happened can be corrected if we simply are willing to do the work and provide the body with the nutrients and the nourishment it needs. But along with the lifestyle and the mindset change. And that's a lot, because we talked about how emotions can impact fertility. But yeah, how you're feeling about this, and then overall lifestyle. So I mean, aside of and the word of sexually transmitted infections and diseases, for me, I mean, it was enlightening, and it just makes the case again for being safe and continuing to get yourself tested and knowing your status, and going beyond just curing it, but also restoring yourself. And it goes back to why we started off with the need to detoxify your body and to get on the herbal regimen and to cleanse, because at the end of the day, all of this stuff has to be moved out. Has to be moved out. And inside, Fertility Family and working with me, one of the things we do is we take ourselves through a 90-day lifestyle transformation, which includes detoxification. And it's a great thing to do in a group, so you have support, as opposed to trying to do it on your own. All right. So anything else you might want to add around sexually transmitted diseases or infections?
Herpes is one of those constant topics that I must address when it comes to STD exposure and working with men and women who are then trying to conceive, where the fear comes in of, I'm not going to be able to give birth vaginally. My baby could go blind. It could, also cause death and so on. It's so many fears that are surrounding being or dealing with that sort of a viral problem, and so I have to give them therapies to bring down that index number, to help their bodies fight viral presence, because they feel like they're doomed to have a challenge like that for the rest of their days, and that they'll be risking themselves so greatly just trying to conceive with that in their systems. And I do put them on a regimen to help their bodies fight viral presence, because herbs don't cure, but they are food to give our bodies so that the body can heal itself. And no one has ever had the flu forever. It's a virus. To feel that you're doomed, have to suffer with a challenge like that for the rest of your days is absolutely inconceivable. And so I've proved it time and time again. My mentors taught me what I have to work with and give my patients to help them overcome this sort of a presence. And the proof is that once they begin a certain regimen program, and I detail all of that here as well, I recommend for them to do blood work, 90-day mark, so they can see how much lower the levels of the presence of the virus is, so they can see how much lower, for example, the index number is, that they're only showing exposure to the virus at that point, or that they're already negative, and so on. So that's the process. They have the proof there in blood work. There's nothing else to say but the fact that their bodies will show us how it's doing. And so I love that we work in this realm of natural medicine, you and I, and prove time and time again that the body knows how to heal itself once it's being fed what it's missing to do so. So know that there is hope, and
there's hope.
We're here for that. Yeah.
And I almost got out of here without just wanted to touch on HPV, because that was a little controversial in that, they were promoting the vaccine, and there was just some controversy around that. So if someone has taken on that vaccine, is there anything you wanted to say around that? If you've taken the vaccine, you may, because ideally to prevent it, but again, that's now in our bodies. If we move on to detoxifying, modifying our lifestyle, will that pretty much cover any concerns related to having taken that vaccine if we're following directions that are in the text?
So I wouldn't recommend anyone inject their bodies with a virus. I don't coincide with the challenges that vaccines bring on. However, if that has already happened, the challenge here doesn't lie only in the fact that they brought that virus into the body. And of course, I work with that. I have to use viral, and all of these questions come about when I'm working with a couple to know what their medical history is. And so I will definitely work with viral immune supplements, specifically Chinese viral immune formulas that you know of as well, to help the body fight off viral presences, even if I'm working with HIV. Now, the challenge with the HPV is also that men can be carriers and have no symptoms.
Mm.
And so that's the challenge there. You're in a relationship, you haven't talked about going to get tested, you've decided to stop using condoms, okay, and they can be carriers. They may never have gotten, and for those of you that don't know, that HPV is also considered venereal warts, HPV genital warts, and I've also written an article specifically on that topic of HPV as well, and addressed many of these aspects. But the challenge here is that HPV, you've gotten the vaccine, ladies, let's say, and the thing is that HPV, how does it affect fertility? Well, most times infertility results from having this infection. Remember, you're bringing the virus into your body. And HPV can also increase your risk of developing pre-cancerous or cancerous cells on your cervix. So think of that. You're taking that vaccine supposedly to help you do what? You're bringing that virus into your body. And you're also risking yourself to precancerous cells of the cervix. And this can cause a direct effect on your fertility and your pregnancy. Cervical cancer can be treated also through naturopathic medicine, know that, especially if it's caught early. But you want to work with herbal therapies that are going to help your body fight off viral presence. You got the vaccine, that's what that's for. I share those herbal therapies there. If you've had HPV or have HPV and you've had abnormal PAPs, ladies or gentlemen, you feel that maybe you were with a partner that was told they had HPV, you've had no symptoms, you think, oh, I'm in the clear. You can be a carrier and not know it. So it's always best do the blood work, find out, and then use the herbal therapies to help your body fight off the viral presence. It is definitely something that can hurt your fertility.
So again, there's always hope. There's always hope. And that's what I want people to know.
Time again, 20 years of working this way, you see that, you see the results. The body's a remarkable thing. It knows how to heal itself. Let's just feed it what it needs to do so.
All right, well, let's talk. Anything else we want to put in around sexually transmitted diseases?
It's all in the chapter. And for those of you that have the book, it begins on page 88. That's where the chapter titled How Sexually Transmitted Diseases Affect Fertility begins. And I give you the solutions there. So.
All right, cool. So let's talk sperm count.
Mm-hmm.
The little wigglies.
Well said, well said.
So crucial to this journey.
Yes.
So a few things jumped out at me. Well, okay. There's no necessary order. Well, let's just talk about maturity. Because so often what we hear, and I'll tell you, this is what started with me. I remember speaking to at least one gentleman about this pregnancy and my plans to become a mom. And he was like, "Did you have old eggs?"
What did he say? I'm sorry?
He said I had old eggs. And then and inside of the conversation, he was like, because men, I gotta find me a young woman because we can have babies forever. But y'all eggs, And what he was
So
not
not
aware
the
of,
case.
right, was how age can impact anyone, including men's sperm health. But again, there's always a solution. But many men don't even realize that their maturity can be an issue. So let's just take a moment to talk a little bit about how can age impact a man's sperm count or sperm health?
So I'll go right to research that I share in that chapter called Sperm Counts, a chapter specifically on men's health and focus there. And for those gentlemen that are over the age of 30 and that are having challenges impregnating their partner, consider the following: that the age of a man most definitely does also play. Oh, I lost you, Kania. I don't know.
Oh, yes, I'm not sure what happened.
Okay, I've lost Kania there. So I'm sure she can come back on here with me. Send me another request here, and I'll accept it right away. While I know that everyone also watching me on Hangouts can hear this. Now, the age of a man, and for those of you, again, referencing my new book, The Naturopathic Approach to Fertility, I'm referencing page 101 in the chapter on men's health, the chapter called Sperm Counts. And the age of a man most definitely plays a significant role in fertility. With age, the proportion
but for so she can come back on here with me. Send me another request here, and I'll accept it right away.
Fertility in a man.
I know that everyone also watching me on Hangouts.
National Library of Medicine studies have consistently shown
normal sperm
increasing male age is associated with increasing the time it takes to achieve conception and decreasing rates of pregnancy. So in one study, to determine the effective age on time needed to achieve pregnancy, researchers assessed surveys from 8,559 couples who had achieved pregnancy. After adjusting for the age of the female partner, conception during the 12-month period was 30% less likely for men over age 40 than for men younger than age 30. Similarly, research from the Mayo Clinic shows that it takes longer for men in their mid-30s and early 40s to achieve pregnancy with their partner than it does for younger men. So for any man that is trying to help their partner conceive and you are past the age of 30, it is most definitely something that I recommend. And that's why I give you a specific male herbal therapy program to help to increase fertility, double sperm count, increase mobility, increase motility. Make sure that there is normal sperm formation. Make sure that it's shaped properly so that all the factors are there so that her body, does not reject your sperm. And so it is crucial for us to take all that into consideration tonight. And I know we're also on 2 cameras here. We're live on also Google Hangouts, and she's trying to come back on in. So what I'll do is I'll send you a request here. Let's see. Okay, add viewers to this. Let's see. No, I feel like you'll have to send me another request here. Yep. Okay.
So what's happening is
I'll bring up the volume so they can hear you. Go ahead.
So I'm live. I see you on Google, not Google. Where are we? Facebook Live, but it's not letting me.
So right now it's not letting
request
invite back. I don't know why we lost her, but please do also write in your questions here. I would love to see some of your requests for us to discuss what you desire to hear more about. And are you able to send the request in again, Kania?
It says I've sent a request.
Okay, I don't actually see it. Oh, there you are. Yes, I'm approving it right now. There you are. And adding you back on so you can be on screen again with me here as we address this one last chapter. And it says adding, so here you are coming on with me in just a moment. Now, for any man with low sperm count, poor sperm formation, low sperm mobility, low sperm motility, regardless of age, know that there is a solution. Know that that can be taken care of, and that it is crucial for you to nourish yourselves as much as possible so that you can most definitely help your partner conceive much quicker. And that's where I bring in those herbal therapies to help double sperm count and so on. What many men also don't take into consideration is how lifestyle choices, bringing in, for example, and it says adding, Kania, maybe you want to accept that request there. Marijuana, and I'd love to address that in just a moment because I have that argument come to me very often, but in my book, I share specifically the story of specific patients. In each one of these chapters, I share their stories. Names are changed, of course, and they were all approached so that they could give their okay, my publisher, to allow us to put their stories here as my patients as well. But let's talk about, for example, marijuana. Again, that argument I hear often.
What many men
as well, Kania.
Also don't take into consideration
so
is how lifestyle choices, bringing in, for example, and it says adding, Kania, maybe you want to
is regulated
accept
by
that
hypothalamus
there. Marijuana,
so we know
and
that
I'd love to address that in just a moment because I have that argument come to me very often. But in my book, I share specifically the story of specific patients. In each one of these chapters, I share their stories. Names are changed, of course, and they were all approached that they could give their okay. Allow us to put their stories here as my patients as well. But let's talk about, for example, marijuana. Again, that argument that I hear often. I'm sure probably you've heard that one as well, Kania.
By the testes.
So marijuana affects a variety of hormones that you can take into consideration. And all of this is regulated by the hypothalamus.
Smoking marijuana, they think many
and that has to be taken into consideration. Marijuana affects the glands by the hypothalamus. And it's important fact for men to know. Smoking marijuana, many of them is harmless. If you are trying to conceive,
marijuana
also in a major study conducted on, unfortunately, laboratory animals such as rats, mice, and monkeys, chronic exposure to marijuana and various cannabinoids it contains.
I explained to the gentleman, he was younger than my patient, his partner, and they found no problem as to why she couldn't conceive as far as he was concerned. Okay, I don't know why it's not allowing me, so I'm going to cancel out. Okay, so there was no reason why she could not conceive once he, was able to discontinue the use of marijuana, something that he'd been using since the age of 17. They were able to conceive just a month or two later. I state their story here, and it's important to take that into consideration. You want your hormonal balance to be where it should be for you to conceive. So here we go. I am accepting Kania's request. Here we are. Should be able to add and approve. And there we go. And it should be coming on now, dear. Yes? There we go. Okay, you're back. Great. Okay, let's put up your volume, dear, so we can hear you a bit better. Go ahead, Kania.
Oh, no. So I was going to make the inquiry about the MJ. So thank you for pointing that out. I know a lot of people are a big fan. They use it to medicate, to celebrate for many reasons. But inside of a, a desire to have a baby, it's something to halt.
Take into consideration, most definitely, that they should discontinue the use for minimum 90 days and then work on conceiving. Your choice if you want to continue doing that after you're pregnant and have had your healthy baby, your choice. But in the meantime, if you're working with me and this is truly a dream that you want, it is something I recommend to discontinue. I put the research there to back up the studies so that they understand the reason why.
And what's interesting about this is it touches on actually the next section in the text, of course, which are lifestyle practices. Because all this is great information. And for someone who's on this journey, if at the very beginning of this, they started on their regimen of herbs, ones we have for men and the ones we have for women, they're going to, how do I want to say this? They'll see some changes. But I just want to point that you have to commit, I think, to an overall lifestyle. And I'm making myself not read ahead in the text because I want to finish it all at once, but it's fine.
Mm-hmm.
But for my gentlemen, a lot of the time, we as you mentioned in the text, we think that infertility is it's something that women carry the burden of. And what's an interesting statistic is that it's actually about even in terms of who is having the issue. But the reality is that if you're a couple, it's both of your issues. And it just makes sense that everyone who's looking to conceive look to optimize the chance of having a happy, healthy baby. And I wanted to point to this piece when we're talking about sperm health. I mean, there's sperm count, and if I'm correct, what I've heard is that over the last 20 years or so, sperm count has decreased significantly, even in otherwise healthy men.
Mm-hmm.
So even if a man is considered healthy,
mm-hmm.
it seems like he would need to, regardless, take on some of these practices, because where sperm counts were 20 years ago and where they are on average now have decreased. Is that accurate?
Agreed. Absolutely. That is one of those factors. And again, it's about creating balance within the body. I love the herbal therapies that I use with my patients because in 30 to 45 days, we're doubling sperm count. And wow. It's crucial so that conception can be easier. And it's not just, and I love that you're stating that, and the count is a big factor. And what also many people don't take into consideration is that the mobility and the motility must be there. Let's just consider, for example, the effects that one feels when they're taking and using certain drugs, certain stimulants, the MJ, as you said, marijuana. And if that makes you slow and lethargic or just a little bit on the too mellow side, what do you think that is doing to your sperm? Okay, let's consider that. We need those, as you call them, the wigglies, to be able to be determined, be focused, be goal-oriented, and be able to be strong enough and precision enough. It's true. It's so common sense. I don't, and I explain it this way in my office, and then they get it, and the patients get it, and then all of a sudden we have a baby when these changes are made, and it's such a beautiful thing. But just think of what if those things affect you in that state. What are you bringing in with your sperm to conceive that egg, to penetrate that egg? What are you developing? And then all of this within your sperm, all of this in the egg, and then that child is developing, what are their genes going to be like? If all of this is in your system, all of this has to be considered, and people need to look back and go back to, how is my body? How am I preparing myself to have the healthy baby that I want? And so it's important that people really break it down in that way. And I do so in an easy, common sense, understandable manner within my book. Things that people never think about is what I take into consideration when I work with my patients. And to have such a high and working with patients to have the success rate that I have for couples that have truly worked together with me, that have stayed on course with me, that have followed through with my recommendations, that's a 100% success rate. For those that have stuck with it, been with me through it, both together, on board together, it's a blessing.
And so, just to put in here, the idea that sperm motility is the ability of an organism or fluid to move. So their ability to move.
Yes.
And so poor sperm motility means that the sperm do not swim properly. They might be going in circles, y'all. We don't want circular sperm.
No, we don't. We want them to go directly to the target. Yes.
And then sperm mobility as distinct from motility.
Mm-hmm.
So what is mobility? If motility is the ability to move, what is the motility?
That motor that they possess naturally to be able to move forward very
okay,
and
so like
strong enough to be able to penetrate the egg. Right, strong enough to be able to penetrate the egg. You know, then we're considering normal sperm formation. We want the head to be formed properly, nice and oval shape, not with any indentations, or you want the tail to be correctly formed as well, not crooked and so on. All of these things need to be taken into consideration for us to have a healthy baby with all 10 fingers and all 10 toes and just healthy.
Mm-hmm. Healthy. All right. Well, this has been a great section. Great session. A little bit unusual, but great. As we move into our last section of the text, we have the lifestyle practices that affect fertility, the role of diet, the holistic and right way to calculate a woman's ovulation cycle. And that's what we're going to be covering in the month of May, folks. Third Wednesday.
I feel excited. Third Wednesday of the month, guys. Get ready to join us here again on Fertility Family Live. I'm excited.
And so is there anything else you wanted to share before we complete?
I would love for those of you out there to know that if you are struggling, if you feel despair, if you've been through the bouts of IVF and had those failures and those didn't take, and you're constantly going through the back and forth of visits and injections and more drugs and so on, and all that despair, and still have not achieved to begin the family that you so desire, please know that we are here at your service. This is a group that is here to support you with other professionals that are here to support you, from doulas to naturopathic doctors as myself and so many other experts that are here to support you in all aspects on this journey. Please take advantage of our services. My work that I know on this world is to definitely help the world have a lot more healthy babies, and Kania here has performed and brought here together this group to help all of you in that. And so I say, please take advantage of this information. It's gold, and we're being genuinely here to support you in every way.
Awesome. All right. Well, for my folks who are online, what that means is that we want you to join the family. We're here to help you succeed. Weekly education in the live sessions, and inside the group, we post a lot of resources, support, inspirational things, articles, and not just about conceiving, but also carrying and even after baby. We have some fun doing some visualization of baby showers and baby ensembles. Because a lot of this is mental too. For me to have a happy, healthy baby, I have to know that. So I'm doing visualization work. I've got my baby board. I spend time seeing myself pregnant. And that is part of it too. Have fun with it. You don't have to be a lone ranger. Next week, who we have in the house is Ajay Wura. She's a holistic womb health practitioner. And she is all about loving your sweet spot, ladies. And so she'll be with us next Wednesday. I invite everyone to join us then. Until the next time, be well. And I always say, stay fabulous.
It was a pleasure to be here again with you, Kania. Good night, everyone. See you guys next month, third Wednesday on Fertility Family. Join the group. We'll see you guys there.